Well, welcome everybody. I'll just wait a moment or two while people make their way from the waiting room into the main webinar space. So please get ready, sit back, relax, and we'll kick off in about 10 seconds time. Well, good evening everyone, and welcome to this webinar titled Flying into Action, Pre-Hospital and Retrieval Medicine. I'm Professor Richard Franklin. I'm the Acting Head of Discipline of Public Health and Tropical Medicine at the moment. I welcome you along for this chat that we're going to talk about. One of the aspects that we do in public health, we've got a great teaching team, and you'll hear from a couple of them tonight about what's involved around this pre-hospital and retrieval medicine space. So before I start, I would just like to acknowledge the lands on which I am on, which is the Bindal and Rugarubba people's lands here in Townsville. I recognise their elders past, present and emerging, and thank them for their custodianship. I say Wadamuli to everybody that's out there, which is welcome or hello in the local Bindal language. So thank you very much for joining us. And as I said before, I'm a professor here in public health. I'm looking after the discipline at the moment, and we are kind of wanting to explain a little bit more about what we do, and this is one really important aspect of particularly sort of rural and remote health and the work that we offer from James Cook University as part of it. I'm joined tonight by Associate Professor Emmeline Campbell. So welcome, Emmeline. Do you want to just say a little bit about yourself?
Thank you, Richard. Yes, I'm Emmeline Campbell. I'm an emergency physician. I've been educating, working in and accrediting services in pre-hospital and retrieval medicine across Australia since about 2002. I've been affiliated with this course since 2009, initially as a student and now as a subject coordinator. My work started as a training ED registrar in Cairns in North Queensland, being tasked out of the hospital onto helicopters to look after sick and injured patients. I then commenced employment with the then Care Flight Queensland, where I worked in Cairns and then across all of the Queensland bases. I've worked in road response, helicopter, fixed wing and international jet missions. And in addition to Care Flight, which is now Life Flight, I've worked in the RFDS Queensland section with Queensland Ambulance Service, Ambulance Victoria and MedStar in South Australia. Thank you.
Thank you very much, Emmeline, for joining us tonight. And, you know, as Emmeline just said, she is still working in emergency departments and still involved with aeromedical retrieval. So we have this great link between practical, on the ground, ongoing experience, and obviously the educational space as well. The other person joining me tonight is Anita Wall, who is a nurse who's here in Townsville with me, but also flies. So again, a really practical person. Anita, do you want to just tell us a little bit about yourself and how you ended up here?
Yes, thank you, Richard. Like Richard introduced, I'm Anita Wall. I am one of the course coordinators for the graduate certificate. And I've been at James Cook University since 2012, in which I was coordinating with Dr. Peter Aiken and Dr. Stefan Mazur up until the last few years when Dr. Emmeline Campbell has taken over. In addition to my academic role at James Cook, I am also a flight nurse with the Royal Flying Doctor Service Queensland, based in Townsville. I've been doing that job for more than 20 years and have worked in all the different bases throughout Queensland. I've had a variety of different roles whilst I've been a flight nurse. Most notably, I was the nurse educator for 10 years. I still work clinically in a part-time capacity, which is a lovely niche to working in academic world as well. So we bring a flavour from the real world into the academic world.
Thank you very much, Anita. It's great to have you here tonight as well. Thank you both for being here after hours, and thank you everybody for joining us. Just as a matter of housekeeping, if you do have a question as we go along, please feel free. Down the bottom of the screen, you'll see a little Q&A section. Please put it in there. We will either answer it at the end or we may answer it as we're going along, because we're interested to hear your thoughts and why you're here and any questions that you might have of these two very experienced both clinicians and also educators, which is really nice. So as I said before, aeromedical retrieval is part of what we do here at James Cook University. You heard from Emmeline before that we've been doing it for a number of years. I think, Anita, next year is our 20th anniversary of delivering aeromedical retrieval, and it really has changed over the years. That certainly I've been sitting on the periphery of it, but it's been a really exciting journey as part of it. So can you talk a little bit, Anita, about what the course is at the moment, I guess, and how it's kind of evolved into what it is today?
Definitely. Very excited to announce really that we are rebranding our graduate certificate as of 2026 and moving from the graduate certificate of aeromedical retrieval to the graduate certificate of pre-hospital and retrieval medicine. The background to that is that we have done a large curriculum review and are really wanting to meet industry standards, and that's including terminology. Another driving force for our big rebranding and our big looking at the entire course was that we're moving from a semester model to a trimester model in 2026. And so therefore that enabled us to have a look at our course as from a big picture perspective and make sure that the content we're delivering over our 4 subjects actually is still meeting industry standard and the industry mark. So we're very excited that we have achieved that. We are definitely going to meet industry standards and content. And we are having our 4 subjects, as you can see on the screen. In trimester 1, we're delivering Foundations of Pre-Hospital and Retrieval Medicine. That is a subject that is actually opened to any students enrolling in any of the public health degrees. There is no entry requirements from our perspective, and it's a lovely niche subject that gives you the fundamental principles of pre-hospital and retrieval medicine. That subject talks a lot about the aviation physiology. It talks about the teams, about the retrieval assets, about equipment. It looks at the clinical coordination and also at some clinical governance. It's very much pitched to any healthcare professional who is interested in wanting to know about pre-hospital and retrieval medicine. I think it's a great subject to do for medical students up to rural and remote doctors and nurses who are retrieving their patients out, to also the clinicians who work in tertiary level hospitals to actually get a good feel of what actually happens whilst they're waiting for their patients to come. Our second subject that is delivered in trimester period 1 is our neonatal and pediatric retrieval medicine subject. That is a very specialised subject, but it offers a great amount of information that's fundamental in preparing and transporting these tiny little patients that are increasing in retrieval numbers. Our trimester 2 subject is our clinical skills. This subject is a mixed modal type of subject that's delivered, in which there is an online component where you do all the theory, and then that theory is brought into a 3-day face-to-face where we apply that in the practical sense. That 3-day face-to-face block is held here in Townsville. There is a caveat with that. If you are a healthcare professional who is working in industry, such as working in Life Flight or MedStar, and you do induction program weeks, then we actually credit that induction program for the practical component, and you will not need to come to Townsville. It's a really fun 3 days with amazing instructors, which I'll talk about a little bit later. And our fourth subject, which is delivered in trimester 3, is our adult retrieval medicine. So this subject is pitched to the critical care type of transfers and the types of complex patients that we're asked to retrieve, such as the obstetric patient, the acute behaviourally disturbed patient, the bariatric patient, all the way down to the end of life retrievals that we're sometimes asked to do. So overall, the 4 subjects is a very well-rounded, lovely delivery of content for up-and-coming retrieval clinicians.
Thank you very much, Anita, for taking us on that journey around the subjects that make up, obviously, the graduate certificate part of the course that we do. I think it is really interesting to hear how it's changed, and obviously picking up on the trimester part of it as well. And again, you know, I do like it kind of, we've been working with industry, and it was nice to be able to, you know, if people can't do the industry part of it, they can obviously come to us and do it as well. And I've got to say, you know, you've just run that course a couple of weeks ago, and we had a whole lot of people on campus here who are out there working. So it's a really good opportunity to meet people that are out there kind of doing what this is all about, you know, being out there in the skies, moving people around as part of it. I guess one of my questions, though, that I have, and I might go to you first, Emmeline, is how does somebody actually end up in this space? Like, what's the pathway, or how did you end up in it firstly, and how might people nowadays end up coming into aeromedical retrieval or pre-hospital and retrieval medicine?
Yeah, thanks, Richard. So those of us who just need a little bit more information about what it's all about. So pre-hospital and retrieval medicine is the rapid response medical care to those patients or casualties that are seriously sick or injured. The care is provided by a specialised critical care team of doctors, nurses and paramedics. Patients are transported by plane, helicopter, road, or sometimes even by boat from out of hospital scenes into the hospital, and also between hospitals, increasing the level of care each step of the way for the patient journey. All missions typically are tasked from a central coordination centre based in a communication emergency services hub. So the pre-hospital and retrieval medicine qualifications, they can be obtained at James Cook University with this graduate certification, which Anita has described previously. Now, these qualifications can be utilised to enhance your experience and also progress your career in this medical or nursing paramedical domain of patient care. Touching on medical personnel who work in this area, all of them have had some training in critical care medicine, be that emergency medicine, intensive care, anaesthetics, or rural and remote. They're trainees or doctors who start off their journey in this medical domain are usually nearing to completing their qualification, having had successful rotations in all of the following. They must have had 6 months of emergency medicine training, 6 months of intensive care training, 6 months of anaesthetics, and also 6 months of paediatrics. And all of these trainees who've actually covered off all of these training rotations have the necessary experience and then can apply for a registrar role with one of the service providers. And this actually also includes consultants who are working in their consultant roles in hospitals who think that they might want to start doing some work in this domain. So in addition to this, we like the trainee doctors to have also some qualifications in trauma experience, ultrasound, and also leadership is becoming important. And a point to note is that most of the pre-hospital and retrieval medicine healthcare providers are clinically governed statewide across Australia and also in New Zealand as well. So then the doctors who meet the selection to train in pre-hospital retrieval medicine are usually employed for 6 to 12 months, where they undergo a rigorous selection process. They get a robust education and training, which can be supplemented with the James Cook University qualification, and careful supervision by their consultant who's overseeing them during their term and also on a day-to-day basis on shift. You then will attend weekly clinical audit in the form of case reviews and also most likely assign quality assurance programs or activities such as looking at blood transfusion in the pre-hospital environment, emergency anaesthesia in road traffic crash examples, and also looking at the number of mass casualty events and also some inotrope administration, particularly in using peripheral venous access. What's really great about this this practice of medicine is that the skills learnt throughout this course are very, very important and something that you not typically will learn in hospital. And these include team resource management and developing a very strong spirit, getting really well known to how to manage critical care equipment and being familiar with them, being very comfortable with the administration of critical care medications, enhancing communication skills beyond the hospital environment, and really touching on improving how you become situationally aware about not only yourself, your team, and also your environment. And I think one of the key factors that we learned working in this domain is really developing those senior clinical decision makings and prioritization of care, which include mission logistics. And of course, those of us who've worked in this work, also this experience opens the door to gaining more experience in a particular extra specialty known as disaster management. And if I could just touch on some paramedical application, the majority of paramedics typically work in the pre-hospital environment and less so in the retrieval medicine environment, which is typically the inter-hospital transfer part of the specialty. But most of them who do the course can be from advanced care to critical care paramedics who are wanting to gain entry into this career, or even those who are very experienced, currently flying in and around retrieval services across Australia, where they can improve on their foundation learning, having worked in the industry, and also being able to contribute to everyone's learning given their environment. I think that's it, Richard. Open for questions. Thank you.
Thank you very much, Emmeline. I think, again, it's really interesting, right? So not only have we just heard that there's a whole range of things around the medical side of it, so obviously the doctor side of it, we've got the paramedics as well that are, as you talked about, predominantly kind of the pre-retrieval, and certainly do a lot of the helicopter work and out there for some of the trauma stuff that's kind of going on as well. You know, we did talk a little bit, and we'll come back, I think, and just find out a little bit more about the specialty and how that's kind of working as well in this sort of space. But then you talked about disasters, you talked about all the other sorts of skills that brings into it. So it's a really complex sort of environment that is going on that you need to be, I guess, skilled for and be prepared for. I'm just going to hand over to Anita to talk a little bit about the nursing role and how that kind of also fits into this space as well. Anita, over to you.
Yeah, thank you, Richard. The nursing role is a little bit different to the medical role in that nurses who have an interest in flight nursing are actually applying for full-time permanent positions. So they're not on a rotational position. There are a variety of retrieval organisations throughout Australia that have flight nurses. Generically, a flight nurse has to have between 3 and 5 years of critical care experience, whether that's intensive care or emergency. And depending on the retrieval service that you are applying for, midwifery is another requirement that you have to have as well, along with some clinical experience. Rural and remote is definitely an advantage for working in the retrieval environment. It teaches you a lot of skills that you need when you're working in this environment. And in addition, there's a lot of short courses that are available that are very advantageous when you're applying. Having done a graduate certificate in pre-hospital and retrieval medicine also would look favourably on CV applications. Because positions within the retrieval services now are becoming increasingly very competitive. And so obtaining all the qualifications and skills before you submit your application will make you very, very lucrative to a retrieval service.
Thanks very much, Anita. It always fills me with strength and, you know, knowing that you guys are out there doing this work and all the training that you've had to become an aeromedical retrieval person. We've just got a couple of answers that I am going to go to which are relevant to what we've just been talking about. We've got an ED register here, and this is a question for you, Emmeline, about saying that I heard that the signing of 3 months plus 50 tubes can be an alternate to the 6 months anaesthetics experience. Is this true?
Yeah, so that is so 6 months of anaesthetics, and hand it from me, it would be a better preference for yourself if you're considering doing this, rather than trying to just get the 3 months and 50 tubes, because as you know, the more you get more experience and the more time you spend in airway management and preparation for airway management, the better. There are some issues in relation to some anaesthetic rotations that are quite limited in the tertiary environment. So having said that, my advice would be to go out regionally where there's plenty of anaesthetic registrar rotations, where not only can you get your anaesthetic experience, but working in a regional or rural setting. So yeah, the 3 months and 50 tubes is a threshold that, you know, may not look favorably upon if you're comparing yourself to someone who's 6 months who's had the anaesthetic training.
And I guess, Emmeline, we were talking about this early on. It is reasonably competitive to get into this space. So you know, while there are a number of jobs, you know, there are only a small number that come up each year, and the people that work in it are obviously competitive. The other question that's just popped up is about, you know, and this probably goes to you firstly, Anita, and then we'll go to Emmeline about this. Is the formal pathway, registered training, the only way to utilise this certificate as a doctor? So what else are people doing with it, and what's the value of having this kind of graduate certificate?
I think the value of having this certificate is when you're actually applying for registrar or flight nursing positions, that you are a little bit more competitive to the applicants who don't have the qualification. But the other major advantage is by doing this course, you get the fundamental principles down pat before you actually turn up to day one in your retrieval service. So that when you're turning up, you're actually building upon organizational requirements, policies, procedures, and the actual. So an example I can give is we don't talk about specific ventilators as such. We talk about transport ventilators and the principles associated with a transport ventilator, because you may go to one service that utilizes Hamilton transport ventilators, and someone might go to another service that utilizes a different type. So we try to keep the course very much principle and concept based, so that when you go to your retrieval service, you're actually just building upon, you're not starting from scratch with your content or your knowledge of the environment.
Yeah, thanks, Anita. So obviously very valuable if you want to continue down this track and get some skills underway as you start on it. I think the other thing, again, is, you know, there is some real value just for those that are working rural, remotely, or even in a tertiary centre, to understand, I guess, what's going on, you know, how they've been transported, what are some of the limitations of transporting people, what might you be receiving, even if you're sitting in a metropolitan area where some of these transports are coming in, what does that mean for you and what's kind of going on there? Emmeline, do you want to just add a little bit onto that? Because obviously you've been a coordinator and seen how this kind of works on a wider kind of health system basis.
Yeah, so I was just going to sort of talk to that, Richard. The fact is that just by having the knowledge of what this course enables, is that you can anticipate the next step for the patient. So once you've done the referral, you can have that mental model that, you know, a team is being activated, that they're preparing their equipment. You actually might receive phone calls to help with your preparation of the patient before the team gets to you, to try and minimise the time the retrieval team has with you at the hospital from that you're referring from. And so that when they get there, you can actually anticipate what their priorities are going to be, how you can be utilised within the team to, you know, help with patient transfer. And then likewise, you mentioned, Richard, so that when a retrieval team is coming into your metropolitan hospital, your tertiary hospital, you can sort of envisage what that team has been through in order to get the patient safely to you. So you'll be very appreciative of all of their time, their carefulness, their effort, and take a lot of time to listen to their handover, because they've got a lot to share with you, and every bit of information they've been trained to tell you is what you need to know.
Yeah, thanks very much. It's always interesting sitting in the coordination centre and hearing what's kind of going on, and certainly the skill that's brought from the aeromedical team to remote areas of Australia is really great. I mean, it's always been wonderful to hear what the RFDS get up to. They've got a fantastic podcast, actually, for those a little bit interested in it, about some of the cases that they've gone out and seen and responded to. Anita, we've got a couple of questions about the nursing side of it. So. Yes. The first question comes in around being a flight nurse, and you talked about 3 to 5 years critical care and midwifery. They just wanted to know whether there's any value around being an ADF medic. Does that have a positive impact, or any acceptance into the program that you're aware of? So
acceptance into the program is, I'm thinking that you need to have a bachelor degree. You need to have a undergrad degree to get into the course. In terms of flight nursing, you need to be a registered nurse, registered midwife to apply. So I'm not 100% sure what a medic in the ADF equates to. If that's an endorsed enrolled nurse, that qualification wouldn't meet the criteria to be a flight nurse. Yeah.
All right, so that's, I guess, probably not is what I'm hearing, but it's something that we can look into in a little bit more detail. Certainly, we do know that the ADF nurses have a lot of skills, particularly from a trauma care perspective. I think the midwifery part of it is the challenge for the ADF ones. So again, we do encourage people to reach out to us because we will review and let you know whether you obviously can do the program or not, and areas that you might need to improve on as part of it. The second question, Anita, is around, as a current retrieval nurse at RFDS, WA, don't hold any postgraduate qualification there in medical retrieval. It's something I am considering. What do you think this course would be beneficial for that type of person?
I think it just solidifies and gives you the formal qualification of what you're currently doing, but also extending. There is a high caliber of instructors that we utilize, which I'll actually go to the next slide actually, which actually teach into the James Cook University course. The advantage of this is that we are not one retrieval service affiliated. We bring in a lot of clinical expertise to give our students the broad depth of knowledge, knowing that not one way is the only way to do things. So we provide students with options of how one particular thing can be done a number of ways, and it's great for cross-pollination and networking. So I think doing our course is, solidifying the knowledge that you have, extending the knowledge that you have, and also providing you with intercollegiality between different retrieval services throughout Australia.
Yeah, thanks very much, Anita. I mean, I would also, being an academic, obviously, encourage all people to come in and extend their educational experience. But I think also for those that might be thinking of other pathways post working in the retrieval space, obviously for us, we do pick up people that then come and help teach. And, Emmeline's a good example of this, that she's now a course coordinator, who's been through the course and ended up in this space because she's been part of the retrieval sort of program that we offer. And obviously from a professional development perspective, I think it's also really valuable as we continue to do that. And I think, as you're talking about, Anita, there are particular things that happen in your service or a particular service as part of it. So again, we try and talk more generically. That then gets you thinking about how things will work in different services and what they might look like as part of that process. So I think there are a number of benefits always in doing this. And I think, again, if you want to move to other services, obviously experience would be wonderful, but also having the degree would help make that transition a lot smoother as part of that process. Not a given as part of it, but I do think that there's some real value. And certainly from my perspective, any sort of qualification shows that you have knowledge and skills in that space, which people can pick up on. Emmeline, is there anything that you'd like to add around why people might want to do it that are already in the space?
I think you've covered off everything. There's just been a question in here around another course that's offered out there with the, of which I've answered in the chat, just in relation to ASIM trainees doing the associateship in pre-hospital and retrieval medicine, which is offered by a co-joint committee between ASIM, KICM, ANZCA and ACRM. This course is not RPL for any of that course, and vice versa. And I think it's what's really important to know how this course differentiates it from other courses is that it is we learn together as doctors, paramedics and nurses, because that's how the team works in this environment. There's no learning in isolation, and at the end of the day, we're retrieval clinicians, and depending on which part of the retrieval we're attending to depends on who's leading the team. So I think that's a big key point about this course, which is all encompassing of the specialty, which makes it so unique. Working in a small, high fidelity, critically care trained team where you can actually get about your business without actually talking and knowing what we each are thinking, aligning together.
Yeah, thanks very much for that. I think that's a really good example of why to come on and do some of the work that we do. I think the other thing, and we've talked about this a bit earlier on, but Anita, we might just talk a little bit about where some of the alumni have ended up as well. So, you know, we've got some pretty illustrious alumni that have been through the programs. You just want to talk a little bit through what some of them are doing now.
So, yeah, we have had hundreds of students go through, and quite a number of them work in different retrieval services throughout Australia and have gone on to do some amazing things. But 3 of our students that are quite notable is Dr. Angus McDonnell, and he was awarded in 2017 a JCU Alumni an award. He has worked in many different areas and is working within the St. John's ambulance space. Dr. Richard Harris is another notable JCU alumni who was the doctor that was involved in the Thai cave rescue a number of years ago. And of recent times, paramedic Mitch Parkinson, who was involved in the Franklin River rescue in Tasmania last year. So it's very exciting that we see students who have come through and done our course go on to do very remarkable things within their work career, but also related to pre-hospital and retrieval medicine. So the skills that they have learned, they have definitely followed through into their work life.
Yeah, thanks for that, Anita. I think the other thing is that we've got a number who have ended up as medical directors in government departments across Australia, from Western Australia to Queensland down to Victoria and Tasmania. I mean, Angus is great to work with. I do a bit of work with Angus around the pre-hospital stuff, particularly St. John work. As part of that. For people that want to know more, there is an Australian story both on Mitch and also on Richard, which are just fantastic to listen to the work that they've done, the challenges that they faced, and obviously you can see the skills that they kind of bring into it, which has been enhanced by the work that they've done, obviously through our sort of program. Emmeline, I just want to go to you a little bit, you know, talking from a medical perspective and the career, you know, we do see a lot of doctors obviously going through and having this obviously as part of their career training. Where have some of those medicos ended up, and how does that kind of work from a medical career perspective, I guess, as well?
Yeah, so this is a really good point. So most of us that do this work, we continue to work in our core specialty. So being an anaesthetist, an intensivist, an emergency physician, or working in ACRIM. So this allows us to work across 2 specialties. So working fractionally, which allows us to, you know, have sustainability and maintain our interest and excitement in doing the work that we do. Some of us, when we say that we go to work, we actually talk about our work in the hospital, but when we're actually going to work in this field, we don't really describe it as going to work. We're just going to go and work, you know, be on the helicopter for the next week. So that's something that's always been intriguing for me, where this work, even though it's work, we don't consider it to be work. It's just this being that we are, important being that we are within this clinical space. So, so yeah, most of the people who, I think, for all of us that have been doing this for many years, even though when we go through a recruitment process, we have a number of applications, we still don't have probably the number of applications that you think you might have. And we find that there are some people who self-select to do this work or not to do this work because they do not feel comfortable working out of the 4 walls and the bright lights of the hospital, where someone can just be at hand if they need it. So the type of people who do this are generally people who are comfortable with what they know, how they can apply it, practice safely, can apply themselves to clinical practice guidelines or standard operational procedures, know who to call when they need to call someone, but are very comfortable working within a small team environment, knowing their equipment and how to use it, and and how to apply priorities of care for the patients that they're looking after independently within with their partner, which is typically a nurse or a paramedic. So that's what's has always been astounding to me, where you sort of think, oh, everyone wants to do this, but a lot of people don't want to do it because they just don't want to be in that uncomfortable environment out of reach. Those of us who've gone on to do a registrar position have then become consultants, and most of us have continued to do this work where we like to share the work between the hospital. But we have that luxury of being able to share our work between the hospital, keeping up to date with clinical practice, which is, you know, typically what happens in hospital spaces, but then also being able to apply all of our skills and our knowledge outside of the hospital in a safe work environment.
Yeah, thank you very much for that. I must say, when you talk about an uncomfortable environment, I've been very lucky to be both on the aeroplane and the helicopter. And to be honest, they are not comfortable working environments as part of that. They're noisy, they're tight, they're hot, they're cold. You know, and I do think you need that resilience, right? You need, you know, I think this is part of what the course builds, is that resilience and leadership sort of space as well. So, you know, kind of thinking about how you can respond in that thing as you work. I think the other thing that's been interesting is how things have changed over time. At least now you can probably get a phone call out, whereas once upon a time you're kind of really isolated, certainly in the areas you kind of work through as part of it. But can you just talk a little bit more about how this fits, I guess, in the wider health service, and how we're seeing, you talked a little bit earlier on about, you know, the different types of retrieval, but can you just explain a little bit more for the audience how kind of aeromedical retrieval fits in the wider health service and how that kind of works?
Yeah, well, so essentially so back in the day, we used to just think that it was just this, you know, the type of people that do that, are these outdoorsy, fit people that get in and out of helicopters and winching and things. But now basically the health system is completely and utterly reliant on this work. It is the conduit between rural and remote healthcare and the metropolitan tertiary healthcare. And predominantly right across Australia, in each and every state, the health system is completely and utterly dependent on these services and is integral. And if anything now, I think the services that this work does is actually driving the health system, keeping accountable to how things are practiced in those rural and remote communities, to being able to educate and train within that and give feedback, do case reviews, to then look after the patient and then deliver them into the tertiary systems, to showing also taking some of the work, that the clinical skill set and work that you would do in the tertiary systems out into the pre-hospital retrieval medicine setting. So you're essentially enabling patients, injured or ill, having access to tertiary care in a quicker time frame, without all of the bells and whistles that you'd typically have in the tertiary setting. So I mean, when I first started, I was a registrar that we'd get a phone call from some hospital, and then the helicopter would turn up. We'd get in these fancy flight suits and not really know what was going to be happening next, arrive in a country health facility and then deal with what we needed to, and then go back to the hospital, hoping that someone would be able to continue the care of the patient. If not, you would be doing it. Whereas now the system is so, it's clinically governed statewide. And everyone is accountable to how patients are referred, how they're treated in the interim before retrievalists get there, how the retrieval team continues to care for them, and then how they're received in the tertiary hospital. So I think in general, patients have, which is what the goal's been all these years, having equal access to care. Patients are certainly getting that delivered. And the next step from this, and which we haven't really touched on yet, but you know, the next level of pre-hospital retrieval medicine is those subject matter experts and the clinical coordinators who are the backbone with the retrieval experience, the inner hospital experience, and then the coordination experience, where they are completely and utterly responsible for having access to referrals from hospitals or primary care settings, to then looking at the case and then triaging them as to how fast the team needs to get there, what sort of team needs to get there, and what's going to be the best asset understanding that happens on, you know, days when there's no weather issues, no staffing issues, no aircraft issues, or, you know, the patient's no longer in the hospital and they decided to go home issues. So yeah, number of factors that the clinical coordinator or medical coordinator is responsible for, which is a whole different level, which we touch on in one of the modules within the course, which, you know, opens everyone's minds to the intricacies in and around that part of the retrieval process as well.
Yeah, thanks very much for that, Emmeline. Anita, is there anything that you'd like to add to that?
No, I think Emmeline's done a great overview of how it all fits in. Yeah, well done.
Yeah. No, I think, I mean, absolutely, you know, as you said, it really is making a big difference for people who do get unwell out in the bush and being able to come in and be looked after. And I think that kind of continuity of care has certainly improved over the years to really make sure that there's a key part of the team not separate to it. And it kind of goes back to the original days with the ambulance work where, you know, is it a scoop and run, or do we now kind of treat people? And certainly the paramedicine space has, you know, changed significantly over the last sort of 20 years also to being highly skilled health professionals that are often part of these teams as well, as we kind of seen going through. So I guess what we might talk about a little bit, Anita, is we might just talk a little bit about, I guess, what else do they need to know before they kind of come to us and start up and want to be part of this course and obviously hopefully start their journey in this space?
Thanks, Richard. Yes, enthusiasm and the interest to come into this environment. And once you've made that decision, it's getting in contact with the university. The entry requirements into the graduate certificate is a minimum of 2 years of full-time equivalent critical care experience, whether that's in an intensive care unit, in an emergency department, or even anaesthetics is included in that. To put it out there though, we do not include internship years or first year of practice for nurses and paramedics. It must be your second year afterwards, in which you've had the 2 years of critical care. The rationale for that is because we have an expectation that you have fundamental hospital-based knowledge that we continue to build upon throughout our course so that you can apply that in the pre-hospital or retrieval environment. When you've made the decision to enroll, it's a simple doing the online application and providing an up-to-date CV that can demonstrate the minimum requirements. That CV gets sent for review by the course coordinator, and then admissions are informed that you are successful or not successful in the mandatory entry requirements. From there, you get your letter of offer, and then you're able to enroll into any or all of the retrieval subjects that we had shown earlier in the slides.
Yeah, thanks, Anita. I think that somewhat goes to the two questions that we've actually got sitting there at the moment, but I will ask them anyway, just so that we're really clear on it. The first one is about enrolling as a junior doctor. Can you do that, or is it best to wait until you're a registrar?
So in essence, if you meet the 2 years of critical care, full-time critical care experience, then you meet the entry requirement. From experience over being the coordinator for a number of years, students who come in right at the cusp of that 2 years of critical care experience, I find struggle a little bit because the content is fast-paced. And is pitched to a higher level. However, it's not that you can't apply, but my general advice would be wait another 6 months or a year to get that really solid experience if you want to get the most out of the course.
Thanks for that, Anita. Emmeline, is there anything you want to add to that, or?
No, that's fine. I was just looking at the next one there, though.
Yeah, so let's go to the next question, which I think there are a couple of parts to it. So this is a person that is just starting their career in medicine and will be joining us next year. So welcome. It'd be great to have you along and be part of JCU in 2026. They're kind of wanting to know a couple of things. Firstly, I think let's talk about the mix of crew that are on the plane. So one of them is, how many people are there? What's the mix between paramedics, doctors, and nurses on the retrieval service? So you can answer that question first, and then we'll go to the second part of it.
Yep, so I can talk from a fixed wing perspective. A fixed wing perspective is we have one pilot who flies the aircraft. If it's a jet operation, there's obviously two pilots, but on within the RFGS, it's a single pilot operation. And medical crew, it is a doctor and a nurse model with, depending on the work type and acuity, some flights are flight nurse only. And if, the patient's clinical condition warrants, a higher level of care, then a doctor will be on that aircraft as well.
Mm.
In terms of the helicopter, Emmeline, did you want to talk to the helicopter?
Yeah. So it depends also on the service. So there are some services out there that want a doctor and a nurse or a paramedic on each job. It's usually a doctor with a paramedic or nurse. Working with two people in a team is much safer than working in isolation, where there are some services that work with single clinicians on board. But generally in all helicopter operations, there is a doctor and a nurse or a paramedic. And this is sort of getting to the theme of, back in the day, it used to be the doctor and the paramedics would go on the primary jobs on the helicopters. But as I mentioned before, it's all about being retrieval clinicians. And then depending on who's on the roster that day, we should all be able to work within the team, have, relatively similar skill sets, know our equipment, know how to use our medications, and know what our shared mental models are to be able to practice our effort on the patient. So that's probably one thing. When we're talking about doctors and paramedics, the beautiful thing about doctors and paramedics is that they do share a clinical skill set. So they, depending on the operator, some doctors and paramedics can both do pre-hospital intubations comfortably shared or independently. Whereas if you're working with a nurse only, then obviously the doctor's the only one who can provide that critical care skill set. But then, typically the doctor is the person who would do the art lines and central lines to gain central access and, arterial monitoring for the patient. But having said that, in a trauma environment, paramedics, doctors and nurses can are trained to do thoracostomies to relieve traumatic pneumothoraces, particularly in patients who are at risk of respiratory arrest or cardiorespiratory arrest from that. So, yeah, I mean, everyone has, and this is one of the things on the course that we teach. So when you come to do this course, everyone has their scope of practice. That's how we typically like you to practice within your scope, and that's what we teach you, to practice within your scope of practice. But having said that, that doesn't mean you shouldn't or not have insight or the knowledge on what are the indications and contraindications for critical care interventions to improve patient care for those who are injured or ill. So that's what we touch on and focus on. And then on the back of that, like I said, some services endorse their clinical staff to be able to do more than what you would be able to do in a hospital, which is fair game for this work that we do. And we're all very comfortable with it. We all practice together and ensure that we're well trained so that when we need to intervene, we can. That's that.
Thanks very much, Emmeline. I think what it also says to me is you need to come along to the course and really understand how the different disciplines work together and what they look like. Obviously, there's the advanced paramedic skills that they'll bring into some of the helicopters and retrieval work that they're doing. Some of that also includes needing to be able to go into environments like dumping yourself in the water to rescue people and other bits and pieces. So, I mean, it is a lot of fun. It's a really complex sort of space. There is a lot of similarities, but as you said, scope of practice makes a difference, and do come along and do a little bit more as part of it. The next question, Anita, I think is for you, which is really about, you can do the first unit, right? So that kind of the introduction to aeromedical retrieval stuff.
Yep.
people can do once. Really, it's a postgraduate subject, so obviously you need to be either all partway through, in the last year or so of a medical degree, or you've already done your sort of undergraduate bachelor's degree to do it. But Anita, do you want to talk a little bit more about that?
So the entry requirement into the graduate certificate, it's a postgraduate degree. So you need to have finished your undergraduate degree completely. And then once you've completed your undergraduate degree, then you need to get your critical care experience before you're eligible to apply essentially and gain entry into the course. In terms of over the years, we've had a number of medical students who do TM 5560, the foundational subject, and they do quite well. It's very foundational. And so, yeah, that's an option for students who are very interested and keen and want to get a taster for the course. But to actually be enrolled in the graduate certificate or the MPH with a major, you do need to have completed your undergraduate degree and have the relevant clinical experience.
Yeah, thanks very much for that, Anita. So you can do it if you're doing that subject as part of a master's degree. Obviously, we allow that as one of our electives. If you want to go on and do more of the subjects, you then need to be accepted into that aeromedical retrieval space. So you can, and we encourage people to come along. It's one of the great things about doing the Masters of Public Health or Masters of Public Health and Tropical Medicine here at JCU is that elective, which allows you to do it. And as I said before, you can enrol in a Master of Public Health once you've got your undergraduate degree as part of it. So it is really valuable for people to get in and get involved. And as we talked about early on, I think one of the real values is if you are going to be working in a rural, remote or regional centre, there is some real value in just understanding how the retrieval space works and what that kind of looks like as part of it. So we're kind of running into the last few minutes and we've kind of gone through a few questions, but I have a couple of things that I just wanted to ask both of you. But Anita, before we go on, is there anything else that you feel that we haven't talked about tonight that people should know about or be aware of or be thinking about around kind of doing the grad cert or doing the Master of Public Health with the major in aeromedical retrieval?
Clearly, I am very passionate about our course, and I think what we have achieved in our restructure of the course is very modern, very educationally appropriate for moving forward. I think we bring a lot of diversity in our instructors who write into our course and deliver our course. All of our instructors are clinical. We are not full-time academics. We are actually clinicians who also work in the academic world. And it's just a very exciting space. And yeah, come on down and do the course.
Absolutely. And that kind of goes to the question that we've got. You can pick it up as an elective, that one subject, around a whole range of Master of Public Health, other majors, if you've got space in your major activity that you've done. So it is possible to do it. Again, we kind of tell people that are more clinically based to do it. So if you're not a clinician, it's a more difficult subject for people to do because it's really geared around being clinical as part of that process. But again, anybody can do it with those caveats that kind of sit there. Emmeline, anything else that you think people should know before we just kind of finish up? And I will just also ask you to talk a little bit about, I guess, some of the societies and other things that people might like to belong to and be part of as well.
Yeah, sure. Yeah, so I'll just one of the things I answered in the question, there was a question around FTE and whether this course, you should be dropping your FTE to do this course. There are minimum hours. I think it's, 10 hours a week or something, Anita?
It'll increase to 12 hours for
yeah,
next year.
Yeah, which is fine because, when you're doing this job, you're not always out retrieving. You actually got a bit of downtime. So I always like to let students know and trainees know that, this is a really nice course to be able to have learn all of the knowledge as in alongside whilst you're applying the knowledge live, whilst you're doing the training rotation. So yeah, you don't have to reduce your FTE to do this course. It's just all encompassing of your experience. It's an additional thing that you can get a lot out of working in this, working as well as applying yourself to a university course. And the content that you learn in the course is a little bit different to the weekly training and education that each of the services offer each week as well. So so that answers that question. And then I think the thing that we need to just let you know about is that there is a aeromedical society that you can join. There's a Australasian conference that happens every year. And this year was just held in, it's an aeromedical conference. It was held in Hobart. Next year it's in Darwin. So I'd encourage you to look that up if you want to go and have some extra learning and sort of meet and greet people that are working within this space across Australia and internationally. There's also a conference that's happening in the Barossa in December coming up. I think all the tickets have run out, but there might be some spare tickets. But it's the first conference of its kind, Australasian Prehospital and Retrieval and Trauma Conference, being hosted by MedStar and South Australia Trauma in the Barossa Valley in December. And then there's a number of conferences that happen internationally. There's a Scottish aeromedical course that happens every February as well. So yeah, they're the other things that you can do in the background to be part of what Anita and I have been sharing with you tonight.
And I'll just add into that for the nurses, there's the Flight Nurses of Australia Society as well. And that is a great little organisation that is very supportive of new and up and coming flight nurses and has a lot of great information on their website. So have a look at that website as well.
Well, thank you very much, Anita and Emmeline. I will also just add that the course is basically online. There is only the 3-day intensive that you do need to come onto campus, so you can do this from wherever in Australia or internationally. If you're an international person, you might enjoy coming to Townsville for a couple of days and then hanging out and checking out some of our beautiful country around here. So it is geared. It's also geared for an adult learner and for obviously people that are working. So, you know, again, as Emmeline was talking about, we do know that people have patches where they can do more work or less work as part of the process, depending upon your shifts and what's going on in your day-to-day life. So again, I think we've set it up nicely for people to be able to do that. It is, as we move to trimesters, a shorter, more intense sort of period, allowing you to kind of go for sort of, you know, what's 10 or 11 weeks and then into the exam period. So it is set up that way. Also, the Masters of Public Health and the Master of Public Health of Tropical Medicine that we offer is also the same. And I would encourage people to be thinking about the wider Masters for this as well. I think the wider skills that you get, obviously understanding public health, understanding some of the tropical medicine issues that we talk about as well, understanding some of the management things that we bring into it, being able to understand some of the papers that you'll read as part of your further career, so your biostats and epidemiology is also really useful for further career in this space. And certainly as we go into an infodemic and a lot of fake news, it's a really handy skill to be able to know what's correct and not correct when you're reading papers and thinking through some of the challenges. We do also do a bit of research in this space as well. So if you are interested in that, please let us know. And obviously we'd be keen to see people on a research pathway as we need, you know, more evidence around this sort of space. There's some nice work going on across the country, but we obviously need more of it as we think critically about what happens in the air and some of the challenges that need to be met in this space. So really, we've kind of run out of time. I do want to thank everybody for turning up tonight and being part of it. I appreciate Emmeline and Anita taking your time out of your evenings and time away from the family to be here and chat to all of us. Thank you all very much for people that are online and being part of the conversation. And do please reach out. There's a lot of information on the website as well. So do jump on the JCU website and look it up and see what else is there. And if you do need to know anything else, we're always happy to answer your questions. So thank you very much. And thank you all for coming along and being part of this webinar tonight. So I'm Professor Richard Franklin. I'm here in Townsville as part of Public Health and Tropical Medicine, and I look forward to hopefully seeing you in one of our courses in the future. Bye for now.
Good night.
Good night.